Hey everyone. Imagine there was a condition that affected approximately 1 out of 5 patients dealing with infertility, and currently it wasn't being screened for or diagnosed in the majority of these patients. And imagine that this condition could increase the risk of a miscarriage by up to 71% and may potentially decrease the chances of getting pregnant by 45% during an IVF. So, this is what we're dealing with when we look at the reproductive microbiome. Basically, what we've seen is that in an infertile group of patients, if we were to screen everyone for vaginal dysbiosis or an imbalance in the type of microbes present in the vaginal canal and the reproductive canal, about 20% of patients have an issue. And the trouble we run into is that out of those 20% of patients, the majority of them don't have any symptoms, so they don't even know it's there. And the baseline testing that's done for patients when they're dealing with infertility does not screen for this, and it will not check for this. So basically, we have a group of patients that may have a very common issue and have no idea they have it, and it's not going to be diagnosed and very unlikely, therefore, to be treated. And like I said, those numbers that we're seeing in a lot of these observational studies is we're seeing that in patients who have this slight even imbalance in the type of bacteria present in the reproductive microbiome. And I'm going to talk about how delicate that balance really is. We're seeing that they may have up to a 71% increased risk for miscarriage. So we're seeing these patients, they're 71% more likely to have an issue with miscarriage in the first trimester, in the first few weeks, compared to patients that don't have an issue with the microbiome in the reproductive tract. And again, with clinical pregnancy rate, they're seeing patients who have an imbalance in the reproductive microbiome. There's a 45% increased likelihood that they won't get pregnant with the IVF procedure. So this is a condition that's obviously quite prevalent, apparently, and we're just learning about how to treat this and how to use this information to help push the odds into the favor of the couple, so that they have a better chance of succeeding in getting a positive pregnancy test and staying pregnant with a healthy child. So when working with the microbiome, um, basically what we usually look at is we want to see greater than 90% dominance by a specific bacterial strain called lactobacillus, the lactobacillus bacteria. And in the lactobacillus types of bacteria present, we usually break it down into four further categories. And a couple of examples of these are lactobacillus jansseni and lactobacillus crispatus. And basically, what we see with these lactobacillus strains is that even within their own four types of bacteria I mentioned of the lactobacillus, we're seeing that an imbalance of those four within themselves can actually lead to vaginal dysbiosis or worse reproductive outcomes with IVF. So, for example, with Lactobacillus crispatus, if we're seeing that more than 60% of the microbiome has this type of lactobacillus, even though it is a lactobacillus, it may actually worsen reproductive outcomes. So it should be below 60%. Same thing with another form of lactobacillus species present. If it's over 35%, we consider dysbiosis. So we're starting to see not all lactobacillus species are actually the same, and they're not having the same impact on fertility. They have their own subcategories and subtypes, and their different impact on the reproductive outcomes. Some are hypothesized to potentially be a bit more inflammatory than others. And so this is something that's very new, and we're still learning about it. And a lot of the labs that are checking for the reproductive microbiome aren't even differentiating between the types of lactobacillus species present. They just say lactobacillus and assuming all lactobacillus species are healthy, which may be partially incorrect from what we're seeing. So we have to start looking at research papers on what kind of lactobacillus strains actually seem to be helpful. And so we're seeing studies on Lactobacillus reuteri, lactobacillus rhamnosus, lactobacillus acidophilus, and these types of lactobacillus strains seem to reduce the growth of harmful bacteria or other microbes, may actually help to protect pregnancy, and may help have a more anti-inflammatory, better immunomodulatory effect. So modulating the expression of the immune system in the locally in the reproductive tract in the uterine cavity. So this is something that, even if a patient doesn't have symptoms, what we see, they have a history of recurrent miscarriages or recurrent implantation failures. This is something we now need to address. And while a lot more studies are needed for us to fully understand, what impact the microbiome has, and understand the intricacy of all the microbes and how they interact with each other, I also appreciate the fact that patients may not have years, before they make their decision on what to do before they go for their next transfer or IVF cycle. So we need to use that information to our advantage safely and the best we can now. And so we have to focus on, what are the sources of dysbiosis or this imbalance in the microbiome as well. So it may be related to the gut microbiome. So we're seeing if there's unhealthy microbes in the gut bacteria, it can actually increase the growth in the reproductive microbiome of these unhealthy microbes as well. And also impacting the urinary tract and the microbiome along there, as well as the vaginal canal and the reproductive tract. So they seem to be all related and share a lot of the microflora potentially. So we need to be looking at, are there recurrent urinary tract infections, recurrent yeast infections, or are there a lot of digestive symptoms that may be present? And in some patients who have the testing done and it shows up with dysbiosis, they have none of the symptoms. So it's not a guarantee either, but we're trying to screen as much as we can. And we also have to look at, what are the pros versus cons of doing a treatment like this. And for a lot of the treatments where we're doing, antimicrobials or probiotics for a short period of time, the potential downfall or risks are minimum, compared to someone who's going for their fourth or fifth IVF, or has 3 or 4 miscarriages consecutively and is, afraid of getting pregnant for the 5th time and not sure what to do to potentially, see if anything can reduce their risk. This is all on a case by case basis, but it's a conversation that needs to be had. And I think there's enough concerning research around how the microbiome may negatively impact and or positively impact reproductive outcomes that we really need to work on this, and experts need to be well informed on this as well to be able to carry that conversation using evidence-based facts and provide educational instructions and share that research with patients as well. So as always, if you guys ever have any questions, drop us a message or send us a DM, and we're always happy to respond. All right, take care, everyone.